Ladies and gentlemen, I have Derek Lacey here with me to do this pre-recorded interview for our conference. Derek is the president of the Irish Society of Hearing Aid Audiologists, and that's known as ISHAA as short. So Derek, would you like to just tell a little brief bio about yourself?
Good afternoon or good morning, everybody. As Carol said, Derek Lacey is my name. I'm the president of ISHAA for the past 2 years. Took over it from Dr. Sandy Cummins during the COVID. So how long have I been an audiologist? Roughly 25 years. Been working with Carol here and a few other Usher syndrome people as well for the past 15 years or so. My job mainly is concerning with hearing aids and the fitting and supplying of hearing aids and looking after the welfare of the recipient of the hearing aid as well. Going forward, I think Carol has asked me to talk about a few things in this presentation to you today, and I hope I cover essential things. And if anybody has anything, they can always contact Carol, I'll post on the question to them or post on the answer. No problem. Is that okay, Carol?
That's great. Thank you, Derek. Mind explaining to our audience how Usher syndrome affects hearing loss?
Well, we all know that there's 3 types of Usher syndrome. My own experience is really with type 3. That's when I usually see people. As you know, type 1 is when you're born with profound loss, and as you progress with type 2, it's mild to severe hearing loss with progressive loss into adult and into adulthood. Born with normal hearing is type 3 really, and progressively loses the hearing as the age, like a sensorineural hearing loss. So what we're looking at with type 3 is a high frequency sensorineural hearing loss, which really can start to develop at any age from, I'm going to say 15, 16. My contact with Usher's people really starts from 18 years of age, where we would try to fit basically a RIC product, as we would call it, or an open ear fit, to encourage them and to encourage the hair cells to keep activating to hear speech and understand speech. So to go back to your original question, is how does it affect it? It really affects the hearing cells within the cochlea of the ear. And it's a genetic syndrome, as we know. And therefore, when the hair cells, the outer hair cells start to, we say they don't recede, they bend down or they fall away. That's when we start to notice the hearing loss and the lack of clarity when people speak. Usually you will be very, very, very good in an environment where there's utter quietness, such as in your sitting room at home, where there's just 1 or 2 people talking to you. But once you introduce the background noise, such as a television, a radio, or even that of a mere electric kettle, the low frequency sounds, which is your inner hair cells, which really are quite good. There's not really too much damage at this stage. Once that happens, then the background noise kicks in and you therefore lose the ability to have clarity of speech. That progresses over the period of time. It's different for everybody. No person is the same. And some people will get there quicker and some people will get there much slower. We'd rather see you get there slower as opposed to getting there quicker. But ideally, the early intervention of hearing aids is quite important at this stage, and we shouldn't put it off. We should acknowledge it and deal with it and embrace the hearing aids and work with them, because the better you hear, the better you're able to communicate and the better you are able to work within yourself to deal with what you have to deal with.
So therefore, it is important then to have regular checkups. And how often should regular checkups be?
Yeah, well, let's look at that. Let's dive into that question a bit more. The same as with your eyesight, you go to see your consultant and you get your optical test done. The same with your hearing. Audiology should be done a minimum once a year, but definitely once within 2 years. And the reason for that is the hearing can change at any stage. We do not know what is around the corner tomorrow morning, whether you get sick, whether you get a flu, what kind of medication you're put on for ailments, what the effect of all of this is. And everything that we take into our bodies has an effect somewhere along the line, whether it's our bloodstream, whether it's our hearing, whether it's our eyesight, whether it's our ability to walk around the place. Because Usher has also got to do with balance. You know, there's a certain amount of balance involved in this. Thankfully, I haven't come across really any issues with the balance. Mainly the problem that we have is the high frequency hearing loss. But to get back, once you have that, you can monitor the what's happening with the hearing over the period of time. And therefore, I would encourage you to stay with the same person most of the time.
And then, you know, as there's changes in the hearing, sometimes the way technology has developed in hearing aids, that they can help to address these fluctuations in hearing loss. Or
yeah, well, the fluctuation in hearing, when you go into the provision of a hearing aid or the supplying of the auditory equipment to somebody or assistive devices, you're always looking down the road. You're not just you're looking at the hearing now, but you are looking down the road, because you know eventually it's going to change, and there's no point having a system that's only dealing with the hearing now. You need to have a system that can deal with what's down the road as well. No problem.
Derek, what should be considered when selecting a hearing aid provider to purchase from if you are buying hearing aids?
Right. Well, what I'm going to say to you first is you've reached the stage where you're with a clinical audiologist and you've dealt with the prognosis of what's happening, and then you've got to go to a hearing aid audiologist, such as myself or any of our colleagues in ISHAA. And any of our colleagues in ISHAA are well fit to look after everybody, and it's the same standard across the board. What I would say to you about when you're providing a hearing aid, if somebody is living in, let's say, Donegal, and they decide to get a provider in Dublin, that's their choice. But really, they have to look at how they're going to service the hearing aid. What's the travel route? How are they going to get from A to B? Is it a 2-hour journey or 3-hour journey or whatever? Ideally, I would try to say to somebody who comes into me now, with the way society has changed, you need, and the availability of audiologists throughout the country, you need to look local, but also you need to look at the service that they would provide for you. It is very, very important that you have access to your audiologist. There is no point having access once a month or once a year. You need to have access to him at least twice or 3 times a year, if need be, that he is conveniently located to you. The idea of service, people think that once you put a hearing aid in, that's it, happy days. It's not that simple. It is for the majority of people, but you do need care, and you do need somebody that's able to look after you and is committed to looking after you for 4 to 5 years. So it's not just going in on a Friday morning, buying a hearing aid, getting fitted the following week, and then bye-bye. You need to be with that person, that journey, for the next 4 years.
Yes,
That's
a good point. And so where would you find a local audiologist? Would you be able to find that on your website?
You would, ISHAA, ISHAA.ie, and it gives a list of all the qualifications and the various locations and when the clinics and day centres is there. As regards to coming to the type of hearing aid, which was the other part of your question, Carol, sorry, was, you know, when the audiogram is done, your audiogram has to be explained to you. And when you understand the concept of the audiogram and what the hearing aid is going to do with that audiogram, then you pick the most appropriate system that is available to you. As we know, prices of hearing aid are through the roof or whatever way. All I'd say to you is this: you pay for what you get. And if you get a good system, you're going to pay for it. If you get a mediocre system, you're going to get a mediocre system, and you pay for that as well. So you buy what's most suitable to your hearing loss.
So Derek, would you mind telling me, as a hearing aid user, how do I know what hearing aid to get the best out of it? Because obviously I'm compensating for sight loss and I need to hear more of the world than anybody else.
Exactly. And that's what if anything we get out of this interview today, that's the thing we're trying to do, talk to you about hearing aids, that people understand why you get the best. Is because it's your way of communicating in the world, and it's your way of living in the world. How do you know you must trust your audiologist. You must have faith in the person that you're dealing with. If you don't have faith in that person, well, then you walk away and you go to somebody else, because this is a relationship that you are going to build with that person. I'm going to say for a long time, but it is somebody that you will have trust, that will have the knowledge to deal with your situation. Everybody will be different. No two people will be the same, but the outcome of the hearing aid should be for the better of how you hear and the end user. You must remember, this is an item, a product in your life that's going to be worn every day for the rest of your life. It's on at least, I'm going to say 16 hours a day for 7 days a week. So it's going to need care, it's going to need maintenance, and it's going to need looking after and programming. And so is your hearing. And that's the person that you can get on with, that you can work with, that you can say, look, this is not working for me. I can't hear A, B, and C. And then they can either reprogram the hearing aid or reset it, or say, look, we need to do something else here. And they can talk you through it. It's not just about pressing buttons. It's about working with the person.
Absolutely. And there are two routes for hearing aids. There are medical card route, and there's also the private buyer, like when you're approaching an audiologist like yourself. So are there tax incentives available when buying hearing aids privately?
Yes, well, let's take it into individuals. Let's look at the health service sector first, and what the provision of healthcare or audiology needs is there. First of all, we have newborn baby screening, which is dealt with in the type 1 Usher syndrome, and that's the national program that is issued and worked by the HSE. Then we come into the hearing aid, the provision of hearing aids again by the HSE, and that's done on the medical card. How somebody with Usher syndrome is accessed the medical card system is through their GP and through the primary care services. And at this stage, let us say that they should be in the primary care services and health HSE services, no matter what. I would like to see them. I would like to see all Ushers people involved in the HSE framework. Then moving into the private sector for the provision of hearing aids. Obviously, the private sector have a far better selection and availability of hearing aids than the HSE. And the cosmetic end of things will be very big with the private sector, but also will be the technology and how the technology and assistive devices that come with hearing aids. Hearing aids have far progressed now since I started. We have digital phones, everything is done on our phone now, a smart app. There's various companies such as Phonak, GN Resound, Starkey, Oticon, Widex, Siemens. There's a load of companies. They all have developed apps for people to work with. And these apps streamline into computers, into your hearing aids for phone calls. Not all the HSE products, I believe, has that availability to it, but certainly in the private sector, from a very basic price up to the top end, have all this availability. And that's important, especially if you are anyway good with technology and you can find your way around the phone or smartphone or Android. They work, and they work very well.
Okay. And at what point should a person living with Ushers even consider cochlear implants if their hearing is progressing?
Okay, again, it goes back to the question that we talked about, selecting a hearing aid provider, because you're going to be with that provider, let's say, for a period of 10 years. Now, there's no time limit on this, but I'm just for an example to answer to your question. And if we see a progression of the hearing loss getting down to a level where a cochlear implant is recommended in the criteria that you meet the criteria, that then is sent on to your consultants team and then is obviously forwarded to Beaumont. Once you're struggling and the hearing aids can do nothing more for you, then you must prepare for the cochlear implant. I'm a great believer in it. I think it does work. There's testimonial out there to say it works. One of my own colleagues, an audiologist, has just received hers, and the comment that she passed to me was she never knew that the beep on the M50 beeped when you went under it, and now she can hear it. So for me, that's amazing, and if we could do that for everybody. It's not suitable for everybody, because if your hearing is anyway good, and I say good in inverted commas, you keep your natural hearing. So, but once you go down under a threshold of 90 decibels, we then have to look very seriously at the cochlear implant. And that's a great service. Dr. Laura Vianney and Jackie Smith and Beaumont, fabulous people, work really well together and work with a team of people that gives you the pros and cons of going down that road.
Would you mind just telling me what tax incentives are available for private purchases of hearing aids?
Okay, well, anybody that's paying income tax, hearing aids, provision of hearing aids, and it's a hearing aid, nothing else. And the hearing aid is the piece that goes behind your ear. It's not the piece that goes in your ear. In some cases it is, but in general cases, with Ushers, it's not. Molds or anything like that. The hearing aid is tax deductible as a medical expense. So your hearing aid is a medical expense, and it's 20% relief as far as I'm aware, but it could be changed. I'm not just 100% on that. You also have, if you're on a contributory pension, or if you have enough what we call PRSI stamps, and you're a PAYE worker, you will get a grant of up to €1,000 for the cost of your hearing aid, or €500 per year. That grant is for, you get one issue of that every 4 years. And the lifespan of a hearing aid is roughly 5 years, 4 to 5 years. I would like to say 5 years to people. A majority, they do last even longer than 5 years, but your grant is every 4 years. And you can get, if your hearing aids break down, the grant is also available towards the cost of it if you're, if you're out of warranty. So generally, you've got two bites in the cherry, so to speak. You have your medical expense and you have your PRSI, which does help.
Well, thank you, Derek, for your time, and we will have a live Q&A session later on in the year. So if anybody has any questions, please email them to contact@usherireland.org, and then we will have a live Q&A, as I say, later on during the year. So Derek, thank you so much for your time. We really appreciate the way you've explained things, and hopefully people will be a little bit clearer about the world of hearing aids. So thank you.
You're welcome, Carol. Thank you. Bye.